In 2025, we saw some of the highest Medicare Supplement rate increases in the history of the industry. I've been in the Medicare business for over 15 years, and even I have never seen rate increases go this high. Historically, rate increases range from 5 to 7%, but in 2025, we saw rate increases as high as 40% in states like Illinois and 25% in various states across the United States. Today, I want to show you a plan that's been hiding in plain sight that can help you combat the rising costs of the Standard Plan G and Plan N, all while giving you the same great features of all the benefits of Medicare Supplement plans. So let's get started. Hi, my name is Mark Pripp. I've been helping people understand how Medicare works and Medicare Supplement insurance for over 15 years. And today I want to dive into a plan that is basically hiding in plain sight that some people know about, some people are afraid of, and some people don't quite understand. And that is the High Deductible Medicare Supplement Plan G. And I know what you're thinking. You've heard about it. You tried to do a little bit of research and you were turned away once you saw the higher deductible. Today, I'm going to break down how High Deductible Plan G works and show you the similarities between Plan G and High Deductible Plan G, the costs for medical services, how they cover the exact same benefits, how they differ significantly in price, and how much each of these plans would cost you if you have them for, let's say, 1 year or 5 year or 10 year. Towards the end of the video, I'm going to do a sample premium and compare what your total financial exposure would be should you have one of these two Plan Gs. Before we get started, the very most important thing you need to understand is that the benefits on Standard Plan G are the exact same benefits as the High Deductible Plan G. Both laid side by side, one is not going to give you more medical coverage than the other one. The difference is how exactly you are going to pay, whether it's per month on a higher premium with Standard Plan G or a percentage of the medical claims when you use the High Deductible Plan G with a lower premium than Standard Plan G. Definitely keep in mind that there are no lesser benefits with either plan. The benefit coverages are identical. The other biggest takeaway when you're considering High Deductible Plan G that is a common misconception that most people don't understand is your traditional Medicare Part A and B are always in place first, and the structure of those benefits is still in place, and Medicare Part A and B will still pay on your behalf according to their medical coverage before the High Deductible Plan G comes into the picture. So let me say that a different way. Most people think that before they'll get any medical coverage from Medicare or the High Deductible G plan, they have to pay the high deductible first, which in 2026 is $2,950. That is not true. And I'm going to show you with some real life examples of what it would cost you to go to the doctor, have medical testing done, or hospital stay, and show you exactly what you could expect to pay in the same scenario if you had either one of the plans. So this is a standard chart that CMS puts out with your services, your Part A inpatient, your Part A deductible, skilled nursing, hospice care, Part B coinsurance. Basically the chart you've seen floating around that actually looks very confusing. I put this here to show you that the Standard Plan G covers those services. The High Deductible Plan G covers those services after the deductible, and as we continue on, it will make more sense as we get into it. Second part, we've got first 3 pints of blood, Part B excess charges, foreign travel, up to 80%. Both are going to cover those. Both will not cover prescription drug benefits or the Part B deductible. Now, prescription drug benefits I'm referring to are prescriptions your doctor prescribes over the counter. If you are going to receive any type of medical injection in the doctor's office, on both plans it's covered. Outside of that, for your standard maintenance medication, you would need a standalone prescription Part D plan, which would be applicable to both the high deductible Deductible G and their Standard G. So again, they are exactly the same in that area. Moving on, some of the features that I love about Medicare Supplement plans, especially if you're considering a Medicare Advantage, they are quite the opposite. Medicare Supplement, as you've heard in most of my videos, is far superior to any Medicare Advantage plan on the market. And your argument may be, well, yes, they're better, but they're more expensive. And that's what I'm going to show you is with the Standard Plan G and the High G, just how those kind of stack up to an advantage. So take a look at here. Again, all of the same features, no networks, no prior authorizations, no annual benefit changes, freedom to travel, guaranteed renewable, and you can see specialty facilities anywhere in the country. All of those features are identical with both of the G plans. All right, so let's get into out-of-pocket examples. What is this going to cost me if I have one of the two plans? And I will warn you, I put together the real-life scenarios, but as you can imagine, and as you probably already remember, original Medicare is quite complicated the way that the benefits work. So I tried to put the chart together in as easy to read fashion as possible. Feel free to pause the video on any of the charts to study it if that would help you understand the features of both plans before moving on. We're starting out with Susan. She has the High Deductible Plan G, and we are making sure that this is an example of her first visit of the year. So she just gets on High Deductible Plan G, brand new to Medicare or brand new to the plan. She just switched, let's say. So she hasn't incurred any medical care yet. So this will be her first visit. And we're going to say that this is for an outpatient office visit with some minor testing. We have an initial doctor visit charge of $1,000, Medicare allowed amount based on the negotiated rates. Medicare says we only allow $700 for that, so the provider honors the $700. So first we have your Part B deductible of $283. You pay $283 of that $700, and the remainder is $417. Okay, back to the left column. Medicare is going to pay 80% of that $417 bill, which is $333. You pay 20% of that $417 bill, which equals $84. That $84 is applied to your High Deductible Plan G deductible. Okay, the Part B deductible does not apply to your High Deductible Plan G. It is a once per year deductible. So in this scenario, your total cost would be your $84 for your 20% plus your $283. So in that real life scenario, you're looking at a total of $368 for that scenario. Here we have Susan with her second visit using the same metrics on the High Deductible G. Initial charge is $1,000. Medicare allows $700. And because Susan paid her Part B deductible in the first visit, it's already been paid. So that means that deductible is taken care of for the calendar year. So now we have a $700 bill. Medicare pays 80% of that, which means they're going to pay $560 of that bill. Susan will pay 20% of that $700 initial bill, which equals $140. That $140 is applied or subtracted from the High G deductible. So the total cost in this second visit for Susan is $140. What I've tried to do is keep this on a Part B basis in the beginning as outpatient because, again, remember, Medicare is made up of Part A and B. So in this scenario, we're talking about basic outpatient care falling under the Part B. And again, remember, the percentages that you're paying on your Part B in the first and second example are going to be subtracted from your total High Deductible G amount. Now, moving on to the same scenario with Standard Plan G, we have Tom with the initial charge of $1,000 again. Medicare allowed cost is $700, so now you have a $700 bill left. You are going to immediately pay your Part B deductible, which is the $283. That still applies in this Standard Plan G scenario. So you're dealing with $417 is left after you paid that Part B deductible. Medicare is going to pay 80% of that remainder, which is $333. And here, the standard Plan G is going to come in and pay the remaining 20% cost, which covers the remaining $84. So Plan G in this scenario picks up that 20% for you, where the high deductible Plan G does not, until that deductible is satisfied. So in the standard G scenario, Tom is only going to pay $283 for that first visit. Moving on to the second visit that Tom experiences with standard Plan G, we're working with the same numbers, $1,000 initial charge. Medicare allows $700. And here's the big difference. Now that Part B deductible, since you paid it in your first visit, it's now satisfied for the calendar year. So we're looking at a remaining bill of $700. Medicare pays 80% of that $700 bill, which equals $560. Plan G steps in and pays the 20% cost of the remaining $140. So in this scenario, Plan G pays the remaining $140 for you, making your total cost for the second visit $0. Scenario 3 is Susan again on the high deductible G with a hospital stay. So let's say the hospital charges are $18,000. Medicare approved cost is $12,000. Now that we're on to Part A hospitalization, you aren't really too concerned about the Medicare approved amount because you're not dealing with 80-20 rule here in this example. So I put it in there just for simplicity. You've got your Medicare Part A deductible, which is $1,736 for 2026. You pay your Part A deductible, which is the $1,736. That amount is applied to the high deductible Plan G, also known, or you could also say subtracted from that high deductible amount. So you've now satisfied almost more than half of your high deductible G amount. So your total cost for that $18,000 hospital stay would be your deductible, and that amount, again, comes off of your high deductible G amount. So moving on to Tom in scenario 3 in the hospital with his standard Plan G, $18,000, Medicare approved $12,000, the Medicare Part A deductible is still there. Now here's the difference. The Plan G pays that Part A deductible. So in this scenario of a hospitalization, Tom is coming out at no cost. Okay, so that's where some of the big differences lie when you put the two plans side by side. The biggest takeaway here is, remember, the features of your Medicare Part A and B are happening immediately. So whatever your coverages are for your Part A and B, they're immediate. They're not sheltered behind that high deductible Plan G deductible. So in my world, in the health insurance world, high deductible Plan G is very attractive if you know what you're looking for. As an example, I have my wife and 2 kids are on a individual family plan, and our monthly premium is now $1,400, and we have a $5,000 deductible before Blue Cross will pay anything. So I'm paying $1,400 a month, and they won't pay anything until I've satisfied $5,000. That's incredibly absurd in my opinion. So when you're looking at original Medicare A and B, one of the risks in it is that there's no cap on your 20%, or let's say if you went to the hospital multiple times, that was, spread out, because that Part A deductible is good for 60 days and then it resets. So if you have original Medicare A and B only, there's no cap on your 20% or the areas of Medicare where you have shared costs. That could just go on forever if you had catastrophic situation. So when you put High Deductible Plan G on top of your original Medicare A and B, it's a phenomenal option because original Medicare is still working on your behalf immediately. And then you have that out-of-pocket limit on the High Deductible G. Basically, when you put these three together, it's as though you have original Medicare A and B with an out-of-pocket maximum of the $2,900. And when I show you these premiums, it's going to be even more of an enticing option because as you see these Medicare supplement premiums increase on Plan N and Plan G, you can't do anything about it. A lot of people will give you advice, well, find a company that doesn't close their block of business and skyrocket the premiums, or find a company that, is brand new that offers lower rates. I'm here to tell you that there are no secret low premium risk pools for the standard Plan G and Plan N. Wherever company you pick, whatever company you're looking at, you're going to obviously find your lowest premium, but premiums are going to increase. So knowledge is power. Once you understand the inner workings of how standard G and high G work, it empowers you to say, I confidently understand now how these two work, and I'm either not comfortable with the high deductible G, I'd rather just pay the premium, which is perfectly fine. I'm not here to say that standard Plan G is bad and I need to go do away with it. I'm simply presenting you with a creative solution that gives you all the same freedom and flexibility of the standard Plan G at a much lower premium. Use those examples to help build cost analogies in your brain, or things you've gone through in the past, or maybe you had a surgery or treatment. You can look back and say, well, I did this and this. What would my cost have been if I had the standard G? Or what would my cost have been if I had the high deductible in the scenario that you just walked through or your spouse just walked through? It will give you a number to work with. And then you could say, well, if I had one of these plans back then, which avenue would I feel the most comfortable with? And that really is what it boils down to is, again, knowledge is power. Once you know the way both avenues work, you can confidently pick one or the other. So I'm going to stop talking. Let's get into some premiums now, and I'll show you the stark contrast between the high deductible G and the standard Plan G. So I've put together a list of some of the largest states based on population. I can't do all 50 states. It would take me entirely too long. I wanted to use this as an example. These averages should withstand averages in different pockets of the country. So I'm going to draw out the most expensive, highly populated states first, and then I'm going to show you some mixed in smaller states in the Midwest. This will give you a gauge or a guide on what you can expect on the standard and high G. So let's get into it. Starting off, we're looking at Florida. This is for a 65-year-old in Escambia County, which is in Pensacola, Florida. This again is just an example. You've got your standard Plan G male, $250, female, $225. High deductible G, you're talking $81 for a male, $75 for a female. Moving on to New York, which is probably the most expensive state in the country. Standard G is $612, and this again is for a 65-year-old, and then your high deductible G is $82. Moving on to California, we're looking at standard Plan G is $250 for either male or female. High deductible G is $77 for either. And then as we get into some of the smaller states, you can see Texas standard G $218. High deductible G $64. That's a whopping difference of 71% less. Illinois $205 versus $68. That's 67% less. Pennsylvania $218 against $63, 71%. New Jersey $204 to $65. So you can see we're hovering right around 70% cheaper premiums on the high G. Moving on to Georgia, we're looking at $227 versus $60. Iowa $249 versus $76. Arizona $222 versus $66. North Carolina $177 and $49 for high G. So again, we're averaging around 70% cheaper premiums for the high deductible Plan G. So again, in the beginning, beginning, you may have been, well, I'm nervous about paying that Part A deductible for a hospitalization on the High Deductible G. But you can see here, you are either going to pay at time of service if you have the High Deductible G, or you're going to pay in the monthly premium. So there simply is no way to get away from paying something. It's just a matter of, do you want to pay ahead in advance with the standard Plan G and be done? Or would you rather save the monthly premiums and pay as it comes with the High Deductible G? Again, what are you comfortable with? What kind of person are you? You'll know right away. Some people love a brand new car with a high car payment and a full warranty. Other people like a paid for in cash Dave Ramsey car that has no monthly payment, and they will share in the automotive claims or repairs if something should happen. So which camp do you prefer to be in, I guess is what it boils down to. Let's talk about another hot button item. Okay, so what is going to happen to the deductible on the High Deductible Plan G? What if it increases too high? So we can't predict the future, but I've put together, these are accurate historical deductible increases for the High Deductible Plan G, going all the way back to 2021 is the most relevant data I can find. So we're looking at a yearly increase of 5% in 2022, 8% in 23, 4% in 24, 2025, 3%, 2026, 3%. So you were looking at a historical data of, maybe 3 to 4%. So you could argue, well, that scares me, but your premium is also going to increase on the standard Plan G. So again, it's a trade-off of what camp do you want to be in? So getting into now the 5-year total premium cost for the standard Plan G and the High Deductible Plan G. Take a look at this. I put this together here. Starting with High Deductible Plan G, your 5-year premium cost estimate is anywhere between $3,700 and $4,100. 10-year premium cost is $7,500 to $8,200. Again, we're talking about the monthly premium here. We're not talking about deductibles or 80/20. On your standard Plan G, 5-year premium cost $12,000 to $13,000. 10-year premium cost $24,000 to $26,000. If you stop and think about this for just a moment, the standard Plan G, that is the guaranteed amount that you are going to pay if you have it. On the High Deductible Plan G, that is the minimum amount you're going to pay for all of your medical care. If you do have claims, obviously your out-of-pocket is going to be added to that. So on the standard Plan G, there's virtually no other out-of-pocket costs, but it's significantly higher. The High Deductible G, your raw operational costs are significantly lower until you use the plan. So again, another feature to weigh long term. Moving on to historical rate increases. As I started the video, I mentioned standard Plan G has had the highest rate increases in history, ranging from 20 to 45%. The average rate increase on High Deductible Plan G has been 3 to 5% per year. And let me stop and point something out. 20 to 40% on an already higher amount. So if you're starting at $200 and you get a 20% rate increase, right? That's a $40 a month increase. That's almost $500 a year. If you're on the High Deductible Plan G, let's just say you're on the High Deductible Plan G and it's a 10% rate increase and your premium is $70. 10% of that is what? $7. So let's say your High Deductible G is $100. 10% of that would be $10. So because you're starting so low, a premium increase is going to be minuscule or laughable because you're dealing with a percentage of such a small number. So again, the point here is neither plan is better than the other. I just simply want you to understand how both options work. I would love to see anybody in a High Deductible Plan G over a Medicare Advantage plan all day of the week, because you don't You don't fear your plan being canceled. You don't fear your networks changing or your doctor not being in network. The beauty of both supplements is all of the freedom and control that you have over your care. Because imagine if you have the High Deductible Plan G and you don't have a hospitalization for 5 years. Well, that's a significant amount of money you've saved in claims and premium. So I hope this information was helpful. I hope I didn't overwhelm you. Again, remember you can go back at any point in the video and pause the different areas to highlight some areas that you may need to absorb a little bit more. I've also included a link in the description of some of the top companies that we represent. I did a video on the biggest or most well-known trusted companies for 2026, so take a look at that as well. If you need help, comment below. Give us a call. We could do a needs analysis. This basically takes in your situation